from Fatima Eye Clinic, Chennai. I'm here to talk on designs of toric IOL. I don't have any financial interest in any of the products mentioned. Well, toric IOLs, we can basically divide them into three categories. One is the monofocal toric, then we have the multifocal toric, and the sulcus fixated lenses. In the monofocal toric, again we have three options. One is the toric IOL with the yellow chromophore. Then we have the clear toric lenses and the preloaded toric versions. Well, first let's analyze the toric lens with the yellow chromophore. The Alcon's axis of IQ, as we all know, it's a time-tested lens. The asphericity in this lens is on the anterior surface of the lens. The toricity is on the posterior surface of the lens, and this can go in through a 2.2 mm as well as a 2.8 mm incision through a D and a C cartridge respectively. Well, the main good factor about this lens is that it covers a wide range of powers, right from 0.68 up to 4.1 diopter corneal astigmatism can be corrected with this Alcon's axis of IQ lens. And the next we have the Hoya's ICER 351 toric. And the unique feature of this lens is that the haptic tips of this lens has PMMA in it. So the main advantage is we find the haptics sticking to each other when we use regular hydrophobic lenses. These lenses, the haptic doesn't stick to the optic. It opens up quite conveniently. And this lens is preloaded. So the problems associated with loading are not there in the Hoya's ICER toric. And the cylinder power correction is there from about 1 diopter on the corneal plane to about 4 diopters. Then we have Appasami's supraphobe toric lens, and this again is a preloaded lens which is available at a very good cost. The haptic comes with a 0 degree angulation. It is also a hydrophobic acrylic IOL. The IOL power correction is available from 1 diopter at the corneal plane to about 4 diopters. Then we have IOCare's Acryol EC toric. This lens, however, loading is required. It is also a hydrophobic acrylic lens, but the toricity is on the anterior, asphericity and the toricity both are on the anterior surface of the lens. If you see here, the power correction is quite phenomenal in this. Right from about 0.9 to 4.55 can be corrected with IOCare's Acryol IOL. And it is also quite cost effective. Well, this is a good invention again done by IOCare, where the lens is customized. See, basically the problem with toric lenses come when we do in high myopes and in hyperopic patients where we are not very sure about the lens positioning and the lens rotating in the long term period. In this lens, the beauty is the overall optic and the haptic diameter can be customized right from 5 to 6.5 mm and the overall length from 11 to about 15 mm. By way the lens centration is much better. Well, how they do this is we have to calculate, give the company a K value, IOL power, incision location, SIA and the lens thickness and the white to white diameter. With these they calculate the capsular bag size and the effective lens position is optimized. And one more advantage is the IOL, irrespective of whatever be the astigmatism, we can place it at 0-180 degree. There is no need to rotate and again place it in a desired axis. Then coming to clear toric lenses, we have Amos Technus toric. Well, this is the only clear hydrophobic acrylic lens available in India. And this lens again requires loading, where the toricity again is on the anterior surface of the lens. And the IOL power correction on the corneal plane is available from about 0.7 diopter to about 2.75 diopters. And the spherical aberration correction of this lens is quite high, it's about 0.27. So if we have availability of eye trace and equipment where we can calculate the spherical aberrations of a particular patient, then this will be of benefit to us. Then we have Rayner toric. Rayner toric lens, again the asphericity is on the anterior surface. The good thing about this lens is the power range. Right from -10 to about +35 they are able to give us toric lenses. And the cylinder power again, it is very precise. They are able to customize our lenses up to 0.25 precision, from +1 to +11 with a 0.25 precision, which is quite good. But the only drawback is it is a hydrophilic lens, not a hydrophobic IOL. Then we have Zeiss toric IOL called the 709M. Well, this is a plate haptic lens and the toricity is there on both the sides, anterior as well as posterior surface. And this lens again requires loading. Well, one big advantage of using plate haptic lenses is that the IOL can be rotated in both directions, clockwise as well as in the anti-clockwise direction. The IOL can be rotated, and the power range is also quite good. Right from -10 to 32, they're able to give us lenses with cylinder power starting from +1 to +12 diopters. Then we have the multifocal toric. We have Alcon's Restore multifocal toric. Well, this is the only multifocal available with toric multifocal available with 2 ads, both the +3 and the 2.5 ads, which we can decide based on the patient's visual requirement. The platform is very similar to the Actros of IQ toric. The power range correction, however, is not as good as the regular single vision toric. They are able to give us correction only from 1 to 3 diopters at the IOL plane. Then we have Amos Technis multifocal toric. Again, this is the only clear hydrophobic acrylic toric IOL available. The near ad in this lens is about +4, and the IOL power correction on the corneal plane is from 1.5 to +4 diopters. Then we have Zeiss multifocal toric. Again, here the advantage with Zeiss is the power availability. From -10 to 32, they are able to give us IOLs with cylinder correction from -1 to +12. Again, the drawback being it is not a pure hydrophobic IOL, it is a philic lens with a phobic coating. Then we have IOCare's Acryol toric multifocal, where the toricity is on the anterior surface, the multifocality is on the anterior surface and the toricity is on the posterior surface of the lens. And the power correction is also quite good at the corneal cylinder correction at the corneal plane. They are able to give us lenses from about 0.91 diopters to 2.8 diopters. Then this is a good innovation by Rayner. We have the Sulcoflex toric IOL. The beauty of this lens is that it's a supplementary IOL. If the patient has a astigmatism which is prevailing over old surgeries, it can be corrected. The overall diameter, optic diameter is about 6.5 and the overall diameter is around 14 mm in length, and it has undulating haptics. Because of this, the lens sits well in the sulcus, and there is a haptic to optic angulation of about 10 degrees, which ensures that there is no touch. You see here the posterior surface of the lens is concave. Because of that, the lens doesn't touch the already existing IOL. There is a space present so that there is no membrane formation or any interlenticular opacification with this Sulcoflex toric. The power availability, they are able to give us customized lenses from ++ to -7, but the standard range is only from -3 to +3. And they even have multifocal toric Sulcoflex lenses available, where the customized power range is right from -7 to +7 diopter, with cylinder correction available from +1 to +6 diopters. But having given a lot of options is always quite confusing. So to sum up, if you want a clear hydrophobic toric IOL, we have Amos Technis toric. If we need a yellow hydrophobic toric IOL covering a wide range of powers, Alcon's Actros of toric and IOCare's Acryol toric are available. If you want a preloaded IOL, we have Hoya's ICER and Appasamy Supraphobe toric. If you are interested in a toric which is very accurate, up to 0.25 diopters, we have Rayner's toric IOL. Then if you are interested in correcting very low spherical powers, both Rayner and Zeiss make lenses for us. If you are interested in a custom-made toric IOL, where you want to be very precise with effective lens positioning, we have the Ultima's Smart Toric IOL. If you want a cost-effective, good IOL, we have Appasamy Supraphobe, IOCare's Acryol, and Biotech's Toric IOL. Well, all these lenses look similar, but definitely they are not the same. Each one is unique. The choice has to be made based on the patient's visual need, IOL power, and the patient's affordability. Thank you. Thank you, sir.